I think that it's incredibly complex what makes a good GP. I think that they obviously have to have medical proficiency because that's what they're there for, but I think they also have to have an ability to form relationships. I think they have to have an ability to see the whole person rather than just the disease, because I think a lot of times in acute hospitals, people only see what you're there for, they don't see the whole person.
I think the most important thing for me is a GP who is prepared to listen to you. He's a GP who is accessible, and a GP, when you go back a month later, you find that he's still there.
A good GP is someone who knows you well. Particularly in my case, I've had my GP for something between 20 or 30 years, and I've kept him because I have any number of complex conditions that need somebody who knows me, and somebody who has probably over those years become a specialist in the sort of things that I need.
So I think the most important thing for a GP is the ability to listen. If they're not connecting with their patient, not building enough rapport, you're not going to feel as comfortable telling them what's going on. And I also feel that quite often, because they're not listening properly, they're not really showing that they care too much, and then I don't feel as comfortable, and then I'm less likely to go back.
I think a caring approach. You have to make sure the patient is on board with you. The negotiation about treatment or lack of treatment or non-adherence to treatment, you can't be judgmental about that. I think being a good GP, you have to have the clinical knowledge. So you have to be on top of the medical issues, but that is only one element. You have to be able to draw out the patient's issues, give them enough time that they feel they've been heard. And then I think it's the negotiation around the treatment plan. And then of course the great thing about general practice, when are you going to see them again?
I went to a number of medical practices. This is going back 15, 16 years ago. And I booked in as a normal patient. And I saw doctors, and I got very frustrated by the fact that invariably you found that the next time you went back, they were no longer there. So I then finally found a doctor who was part of one of the practices which were owned by the doctors. And I started with that doctor then. That doctor is still there, and I'm still with him today.
I didn't actually. What happened was that we had a friend who was a GP, not our doctor, just a friend who was a GP, and his brother-in-law had a practice in Manly. So when we moved to Manly, we looked him up. And that's how we got our GP.
He set up a practice many years ago. It was the local practice, and my family's been going there for years.
So I moved to Sydney to go to uni, so I left my family GP of 18 years and then had to move to Sydney and find another GP. So I kind of GP hopped, so to speak, around the bulk billing kind of clinics because I couldn't afford to actually go pay a doctor because I was a uni student. And then I eventually found one at a bulk billing place, and he was really great, listened to me, made me feel welcome, and I really connected with him, and so I stayed there, and I've been there ever since.
I presented with what turned out to be Guillain-Barré syndrome, which is a very rare thing, and he had never seen a case before in his life, but because he had read about it, he knew what it was immediately, identified it immediately, and I was sent to hospital immediately. It's fairly unusual for a person to be diagnosed so immediately because it is such a bizarre disease. So, I mean, for him to have that diagnostic ability to deal so effectively with something he'd never seen before, it's just what I owe my life to him, basically.
So I think the number one thing he does is he acts as that middle person between me and the other services, particularly with mental health. So he's been on a long journey with me through this, with like looking after my medication and then referring on to counsellors and psychologists and the psychiatrists and kind of being the middleman between all of those services.
We chat about his family as well as myself and my kids. We have a lot in common, and whenever I have had a problem, he's been very quick to get on top of it. If there was any negative side to it, is the fact he sometimes is a bit of overkill. which I suppose in hindsight it's better to be overkill than it is to not have sufficient attention taken at the time.
So I think the GP needs to ask questions as well in a way that nothing shocks them. They just need to get those questions out there. And I often start by saying, look, I've been a GP for a long time. Nothing you can say is going to shock or upset me, but I really want to get to the bottom of why you're here and what's going on. Or I just feel that there could be a little bit more to that issue. Are you comfortable to tell me a little bit more about what's going on? Those sorts of really open-ended questions. You don't want to use medical jargon. You just want to get the patient comfortable to talk to you.
Look, I mean, I will always find the challenge of general practice as being the need to refer almost day-to-day things in a complex care arrangement through the general practice system, as in referrals to specialists. Because when you get in a position like mine, you know that you have to deal with a certain amount of specialists. So the necessity for the GP necessarily to be a gatekeeper all the time is a problem. It's a physical inconvenience because you have to get there. It can sometimes be a financial inconvenience because you have to pay to get there.
And one of the main challenges is having a GP, because we're at the stage now where he is maybe a bit younger than us, but not very much younger. He was a one-person practice and was there all the time. Now he has gone into a group practice and only works 3 days a week and is decreasing that. And I have no idea how we're going to replace him when he retires. Absolutely no idea how to even go about it. So, I mean, I guess maybe we'll ask him for a referral.
I would like to see if someone has a 15-minute appointment or a 30-minute appointment, that they try to keep to those appointments.
Okay, so I think the number one thing I've found difficult with general practice is the ability to find a GP that is free or bulk billed. So I think the biggest problem I had in the beginning trying to find a GP was that they were just trying to get me in and out and didn't really build that connection. So I think that's probably the number one thing that GPs need to look at, is building that connection.